my YouTube channel. It's me, your lactation consultant. Today, I'm going to discuss another interesting topic. But first of all, I would like to thank you, my new subscribers and my older subscribers, for being there, watching my blogs every 2 to 3 days. And I'm very grateful na nandiyan pa rin kayo. And I'm hoping na every week, makapagbigay ako sa inyo ng marami pang mga ideas about breastfeeding, about your babies, about yourself, about formula feeding, etc. So today, I am going to address another problem with breastfeeding. This mom messaged me privately. She is so concerned because she is not mom. She's a first-time pregnant woman, okay? Soon, in 2 months, she's going to deliver a baby, okay? She doesn't know if it's boy or girl. Now, she messaged me because she's so concerned about her nipple. She really wanted and desperately wants to breastfeed exclusively because of some financial constraint. She cannot afford to buy formula, she said, and she's really want to prepare before she gave birth on what to do about breastfeeding. So she asked me about her problem, and I'm going to share it with you. Her problem is she has a really tiny, flat nipple. A flat nipple. So I'm going to demonstrate to you the differences between a tiny, small, flat nipple versus just a regular nipple, and what are the problems with a flat and short, tiny nipple. So this is an example, okay? This is a tiny little nipple, almost close to flat shape. See? It's probably like even a 1/4 of an inch extension of the nipple. So it's really tiny, it's almost flat, and you can tell that if, for mostly Asian breasts, almost like this size, okay? For Western women, mostly they have larger size of breasts, okay, based on my experience in our breastfeeding clinic. Now, for a regular nipple like this, which is a really good shape, protruding nipple, and you can see it's not flat, it's pointed. So when you look at it, it looks like a really perfect nipple, a really perfect size and shape of the breast, and a perfect shape and size of the nipple. When you look at this, look at this one. So this is like a Caucasian woman, a Western woman, and this is like an Asian woman. So you can tell for Caucasian, sometimes they have a little bit of red areola or pinkish areola. For Asian, you may notice that you maybe have a darker brown color of areola, or even almost brown black color, okay? So that's a difference. So the biggest problem of this is this, okay? Because the nipple is so tiny, it's almost close to flat size, plus flat shape, plus it's really, really short. So how can you prepare yourself? If you're pregnant right now, and this is the shape of your nipple, how can you prepare that when the baby comes out, the baby will be able to latch right away without any challenges or difficulties? So I'm gonna teach you today. I think I did few videos of this before, the difficulty of latching, but this is specifically for a short, flat, almost flat shape of nipple. Now, with this type of nipple, and if you are pregnant right now, there is a solution. Especially, let's say, for example, you have 6 months or maybe 5 months to go before you give birth. So you have that amount of time that you can prepare for this nipple on how to improve even before the baby comes out, okay? It's called nipple correction, and I did it before for nipple correction. So again, this is specifically addressed to the person, kudos to you, whoever you are, who messaged me about this, okay? Now, if you're pregnant, going back, if you're pregnant right now, you want to prepare your nipples so we can do a nipple correction in a normal way. We didn't need any surgery, okay? No surgeries needed. So what we want to do is to make sure that this short, almost flat size of nipple, I want this to protrude, meaning to extend it a little bit longer, to be stretchy so that the baby will be able to latch when the baby come out. So what you're gonna do in a gentle way, see, when I'm doing this, because this is a fabric, this is made of wool or a yarn wool, so it's easy to stretch. But just to demonstrate it to you, when you do this one to yourself, our skin can be stretched as well. So if you have 3 or 5 months to prepare, what you're gonna do is, let's say, before you go to bed or while you're taking your shower or you just like, you know, have a free time at home by yourself, do the stretching, but be very gentle, okay? I don't want you to traumatize your nipple. So if you do this one, preparing your nipple, especially if you notice that your nipple is really, really short or flat or really tiny, then there is a solution. Yes, it may take weeks, it may take months before you can see an improvement. But when you do prepare this, make sure that you do this one even 5 or 10 times, maybe 2 to 3 minutes every time you have time at home when you're in bed. Do this one to prepare. Now, remember, when you have a flat kind of short, tiny nipple in a normal shape of your breast, just with your normal shape, okay? Now, remember, when this breast get gonna get fuller because of the milk inside. So the skin gonna be stretched, right? So this is probably just the right size for my hand. But when the milk is in, the skin gonna be so stretched. So what happened to the nipple? What happened to the small, tiny nipple when your breast milk is in? Your nipple will shrink. It's gonna go hide away. Because again, your skin is so stretched. So that means when you have tiny little nipple, short little nipple, almost flat shape of nipple, and you get engorged or your breast gets fuller, maybe after 3 days or 5 days after you give birth, guess what? This nipple gonna be kind of hide away or shrink down, okay? Because again, your skin is so tight. That's gonna be the big problem when you start to latch the baby, okay? Because during these days, let's say 2 days, 3 days after you give birth, this is the time that the baby gets very alert, looking for your milk, because by that time, the side effect of the drowsiness of the medication during labor or the epidural or the medication that you were taking during labor that causing the baby drowsy, after 2 to 3 days, the baby gonna be alert. Hallelujah, mommy, I'm ready for milk. What if this one gets so flattened? What if this one gets too short, too tight that you cannot latch that baby? So I really want you to prepare yourself, because if you don't, my goodness, imagine that hungry little mouth of your baby trying to find a way on how to latch that really tight breast nipple. So what you're gonna do, if you're gonna be struggling during that time, I want you to massage. So you can do a counterclockwise massage or clockwise massage. You can even do any type of maybe vertical massage. Get it softened. Then if you can see a good supply of colostrum or good flow of milk, set it aside. Maybe you can get a med cap or a syringe. Keep that, or maybe just give it to the baby while you're doing the massage. You need to make sure that this breast is softer. You need to, because if this breast don't get softer before you even latch that hungry, starving baby, your baby's just going to be crying a lot. Pushes you away, don't want to do it anymore, because again, the baby's looking for, where is that nipple? Where is that nipple? The nipple hides away because again, your breast is too full, your breast is too hard, your nipple is too short and almost flat size. So flat shape. So that's gonna be your assignment. You have a homework to do if you are planning to get pregnant or pregnant right now, or you're breastfeeding right now and you really notice that your nipple is really not protruding like this, okay? This is a really good shape of nipple, okay? And this is, when it goes flat, you're gonna struggle with this, okay? Another thing that I've noticed of my patients, okay, when they have a short nipple, sometimes if the baby has a really tiny mouth, baby is really tiny, the lips is really thin, that's double the struggle. So it's always good when you're assessing the problem, what's really the cause why the baby cannot latch? Is it really the mom's nipple, the mom's breast, or it is the baby's problem? Utilizing the baby's muscle tone, especially in the orofacial area where the mouth is, the lip tone. If this one is really weak, no matter how good your nipple shape is, no matter how good your breast size is, if the baby really not deeply latched, then you're gonna have a problem. So again, it is not just because you have a short, tiny, little flat nipple. It is also because the baby probably don't know how to latch deeply. So you really need, if you can really find a really good nurse before you get discharged from the hospital, to teach you how to latch this baby deeply, even if you have a compromised shape or size of your nipple. Because as I mentioned this before, it is not nipple feeding, it is breastfeeding. So when you do breastfeeding, it's really the amount of how much breast tissue like this that the baby can latch, not within just the nipple area, okay? So again, breastfeeding is breastfeeding, it's not nipple feeding. So if you're so worried right now that your nipple is flat, that your nipple is short, that your nipple is tiny, just remember, it is not nipple feeding, it is breastfeeding. So you really have to watch the videos that I've created on how to latch your baby deeply, even though you have a flat nipple or a short, tiny little nipple, okay? Because I've seen so many of my patients in our breastfeeding clinic that able to latch even with a nipple problem like that. So again, good luck with this, okay? Make sure if you are still not pregnant right now, you're planning to get pregnant, and you look down and said, uh-oh, what did Nurse Alona mention about this? So you need to do, it's okay, we can do nipple correction as long as you know how to do it right, okay? This information given to you are all general information. If it doesn't fit you, it doesn't suit you, you need to seek doctor's advice. If you can find a lactation consultant in your area, she may be able to help you on how to latch the baby and how to prepare yourself before the baby comes out. Thanks again for watching. More videos to come. See you next time. Bye for now.